a trained DVM, Western trained doctor, but you also are using this holistic approach. So what's the value add for the client and for the patient, because you're using Eastern and Western?
That's a great question. Well, there's many different ways that it is different. For me, the value as a practitioner is I take a lot of time during my initial exams. As a Western vet, when I was an emergency vet or working in traditional practice, I often did not do the initial physical exam. A tech would go see the animal, take their temperature, pulse, respiration, tell me what was going on, and I would go in and sort of take a cursory history, but only about the complaint that that person was there for today. Say the animal came in for coughing. I wouldn't really look at the whole history. I wouldn't talk about past illnesses. Why is this patient vulnerable here? So it left a lot of blanks in my treatment protocols, and a lot of patients that had to come back repeatedly because we weren't getting to the underlying cause of the issue. Another real benefit is that I always say this to people, so people who have come in before have heard this, but in Western medicine, if we go to the doctor and we say, hey doc, my elbow hurts, we're like, oh, it's the elbow. We look at the elbow. We take an x-ray of the elbow. In this tradition, I stand back, I look at the entire being, and I ask, what is going on that this elbow has gotten hurt? Disease, dis-ease, is not normal. We are made to be healthy. Unfortunately, we seem sometimes as doctors to forget that the body's natural default is health, and that our job really should be to support that patient in getting back to health, or as much health as that they can be in. So those would be the values for me as a vet, is that I get to spend a lot of time with my patients and my clients using both my Western training and my holistic training and designing a protocol that uses everything to best treat my patients.